Hello, I'm Justin Gallagher, Associate Publisher of the American Journal of Managed Care. Welcome to This Week in Managed Care from the Managed Markets News Network. An exclusive report from the American Journal of Managed Care has revealed that Horizon Blue Cross Blue Shield of New Jersey's Population Health Initiative could have consequences for the state's expectant mothers. OMNIA, the insurer's tiered network, has excluded two of the state's busiest maternity hospitals from Tier 1, making them more expensive and less attractive options for expectant mothers. Already, OMNIA is disrupting physician relationships with patients as pregnant women are redirected to hospitals included on Tier 1, according to St. Peter's University Hospital. Since it was announced in September, OMNIA has drawn resistance from urban mayors and legislators and is the target of two separate lawsuits. To learn more, see our story on ajmc.com. A U.S. Senate committee report released this week found that Gilead Sciences knew its price for Sovaldi would cause payers to restrict patient access to the treatment and would present challenges for government health programs. Approximately 1/4 of patients are initially denied life-saving hepatitis C drugs in an attempt to keep costs down, according to a Yale University study, and Blue Cross of California recently became the target of a lawsuit for limiting access to treatment to only the sickest patients. Dr. Scott Gottlieb, with the American Enterprise Institute, explained that policy actions that bring more competition to the market could help curb the costs of these drugs.
If we're looking for sort of policy things that we can reach to, I think it's ways to enable second and third in class drugs to come to market potentially as efficiently as a first in class drug. The system isn't always designed to do that, and very often you'll see the first in class drugs have a much different regulatory process than a second in class drug. And those are things we could think about if we're looking for policy solutions that are far preferable to some of the other alternatives people are talking about, which is more administered pricing type of approaches.
This week, as the world observed World AIDS Day, the National Institute of Allergy and Infectious Disease released a commentary that called for the broader use of antiretroviral therapy for prevention, not just treatment of AIDS. Drs. Anthony Fauci and Hilary Marston reviewed the results of 3 key trials and found that early use of antiretroviral therapy reduced HIV transmission and decreased the likelihood of patients developing other serious illnesses. In the article, published in New England Journal of Medicine, Drs. Fauci and Marston wrote, "Taken together, these studies provide an evidence-based blueprint for effective treatment and prevention of HIV infection and will serve as critical tools in the fight to end the HIV/AIDS pandemic." Finally, the CDC released data that show a measurable drop in new diabetes cases for the first time in a generation. In 2014, there were 1.4 million new cases compared with 1.7 million cases reported in 2008. However, experts are unsure what is causing the decline: healthier eating and more exercising, or if the disease has simply peaked. To learn more about diabetes and its treatment, register now to attend Patient-Centered Diabetes Care 2016, which will be held April 7th and 8th in Teaneck, New Jersey. The event offers unique perspectives on emerging topics in diabetes care from today's leading health experts. During the 2015 meeting, Dr. Robert Gabay, Chief Medical Officer of Joslin Diabetes Center, explained the importance of attending.
I think the great thing about this conference is the confluence of different backgrounds and interests that are brought together. So we had some very passionate patients talk about the impact of social media and how that can be a great enabler to better diabetes care. And that's at one end of the spectrum. Then you've got groups of providers that deliver care in a variety of innovative models that we've heard about. And then the payer community, which is an important piece of this. Often those groups don't get to sit down in the same place and really interact. And you know, what's been nice is there are a number of networking opportunities and sessions that happen here at the conference where you see people from different parts of the equation all talking together. That I think is what's really going to move us all forward.
For the Managed Markets News Network, I'm Justin Gallagher. Thanks for joining us.